Hello, everyone, and Assalamu alaikum. So my name is Dr. Hashir, and I'm here today with Dr. Karim, who is a hospitalist at University of California, San Francisco. Dr. Karim, it's nice to have you here for giving us the time.
Yeah, Assalamu alaikum, everyone.
So,
Pleasure to be here.
first question I want to begin with is that how would you describe your field? What exactly is it is like being an internal medicine specialist or someone who is a hospitalist? What do they do? What are their dynamics? How do they manage their work-life balance, etc., etc.?
Again, thanks for having me. Hospitalist is a very exciting field. It's fairly new compared to other fields. It's a branch of internal medicine. Classically, when you think of internal medicine, you think of outpatient care and inpatient. But with at least within the U.S., the hospital environment has gotten so complex that it's that you now we have people who just focus on just a hospital environment. So it's exciting in that way. Just focus on more kind of acute patients on a day-to-day basis. For me, I prefer that a little bit more than kind of outpatient care, just because for me, outpatient was a little slow. That part of medicine I didn't like so much, and just kind of more personal reason. As I was going through residency in New Jersey during my residency time, um, COVID hit, and so I didn't get and so we didn't get much training. All our clinics shut down. I didn't feel like I got enough exposure to that, and so that's probably just another reason why I personally went more towards hospitals, just because I felt comfortable in the environment. I felt like I hadn't got enough outpatient exposure just in through my residency, and so that was the reasons why I kind of went towards that direction personally.
So then the follow-up question here is that here in Pakistan, in my country, the internal medicine specialists are usually referred to as general physicians. They can like diagnose all the conditions. Like if you're talking about liver failure, you're talking about pulmonology, you're talking about gastric issues, you're talking about cardiac issues. They are dealing with every sort of ailment and disease, right? But at the same time, we see that and there's a cardiologist, then there's a neurologist, there's a pulmonologist. So does someone who is an internal medicine specialist, do they have to specialize in these particular subspecialties, or can they work just fine while being an internist or a hospitalist?
Great question, and it kind of gets to the root of what an internal medicine physician is. You could be an internal medicine physician and just constantly consult everybody and refer your patients, but then you aren't really playing a role. So I feel like what you do as an internal medicine physician is you bring everything together. And internal medicine physician would has different level of comfort with different specialties. People have their strengths and weaknesses. So people pulmonary versus cardiology, and so what I may call a consult for in cardiology, my colleague who's maybe has more experience in cardiology or wouldn't call a consult because he feels comfortable, right? I think one clear criteria when you do refer is if anybody needs procedures done, because obviously we don't do procedures. So if somebody needs a cath or a stress test, then at that moment you probably do have to send out to a cardiologist because that's just something we can't do. But the moment now, do you have to specialize? The biggest reason I didn't specialize, as you go through residency, you see all um, these different specialists, right? You kind of spend time with them. I kind of, like to get a lot of variety. I like to be thinking of different things, kind of looking at the big picture and how everything kind of fits together. And so that's why I kind of chose this field. And I think the other reason was I feel like people who specialize fall in love with like one organ, right? They just love kidneys and they love doing a UA or like the ABGs, or they love something so special about it. I never really found an organ that really kind of drew me. I kind of felt like like I just kind of like knowing as much as I can about everything. That's I think that's probably a way to kind of
So
look at
from
it.
your perspective, if someone likes to stay dynamic as a doctor, then internal medicine is a great field for them because they can get exposure from every specialty and subspecialty, right?
Yeah, because you're the one first seeing the patient, right? And so you need to first kind of do your preliminary investigation, and so that kind of mystery is still there. If you're a cardiologist, by the time you see the patient, typically, they've already been seeing somebody. They've already had a lot of workup done. And by the time you go in, you're just kind of doing the last bit of it, or just helping either with some sort of management or with some sort of like procedure or complexity. But you're not doing the initial kind of groundwork. So if you kind of like that mystery and the groundwork, and I think internal medicine it will help you flex that part of your brain.
So now now my next question would be that that we received while working on this project was that someone was feeling totally like bamboozled that what should they do because they are about to start their internship and their internship would last for 1 year, and then they're like, I do not know where to continue with this. I'm not sure if I want to practice medicine in the future. So they wanted to know more about like what it is like practicing internal medicine. If we can narrow down this question to like work-life dynamics, and is it possible for someone who's an internal medicine doctor to manage their home life and their hospital life, the interaction between the patient and plus their own physical and mental health?
I think a lot of it is personal. First thing is like, from a mental health perspective, just making sure you really do truly enjoy what you do. Right. One thing that I like about medicine is there's so much you can do, and depending on what your strengths or weaknesses are, you need to work towards that. So, for example, I can give you, I had one time recently. I had a resident who, whenever a patient would be really sick, or there would be a patient who died, who passed away, right? Or not even that, but even if a patient was just very rude to her, she would just cry, and it would just really hit her hard. And I would talk to her, and she'd be like, "Oh, when I see these people, I see an old lady pass away. It reminds me of my grandma, and I just can't handle it." Fortunately, she got into radiology, which I told her, "Great job," because you're not going to see, you're not going to have to deal with these type of patients in radiology. You're kind of behind the screen. So what the point I'm trying to make is like looking into like what you want to do and what you enjoy and what you're good at, and making sure and look for a specialty that does it, because kind of getting more into like my work life balance, right? So in the hospitalist world, the way it's you're on your feet, right? If you don't have your office necessarily, you're kind of running around the whole hospital. So if you're someone who likes to be on their feet like me, um, I don't like to really sit at a desk or a table or even have my own area. Like I do have an office or like a workstation. It's empty. Like it's just not my thing. I'm not somebody who likes to sit somewhere, right? I'm usually, wherever I'm in the hospital, if I'm on the seventh floor, eighth floor, wherever I'm at, I just like to be near my patients, do my work there, interact with nurses, right? So just with hospitalists, I think it's more you're kind of on your feet, you're running around. You do get time to sit down as well. It's not like you're all day on your feet. The probably thing I like best about it is you really talking to patients, explaining to them what's going on. It's really something I enjoy. I do enjoy, for whatever reason. I know a lot of people find the most difficult, especially where I'm at in the field I'm in. It's like dealing with specifically with like patient with psychiatric issues, drug issues. They could be more challenging. If a patient is very upset or concerned, I take it as a personal challenge to see how I can make them understand, and how patient can I be with them. Of course, there are times where that doesn't work out, and it can be frustrating. But overall, I think that is a part of the job I enjoy, and I think I enjoy it because I do take it like a challenge.
So if I can extract the most important point from this whole discussion is that the person, the medical student, should know themselves better.
Hmm.
First, they should work on themselves, like, and then they should decide that what specialty they are about to go in. So, according to you, when should this journey start? Like, when should a medical student should begin their journey of planning what they want to do after their graduation? Should they do it from the first year of the medical school? Should they begin pondering over it in the third year when they're just starting the clinical rotations, or they can like decide it whenever they want to?
I mean, I think I don't think it's like I think it kind of evolves. Like for me, I never understood pathology. I look at a microscope and they say see this, and I would just never see it. Right, so I knew like right away I'm not going to be a pathologist. But one of my good colleagues, he loved it, and he used to talk about this stuff all the time. He tried to help me, and I could never figure out what he said. So and now he is a pathologist, right? So I think it can start in first year. For some people, it takes longer. For me, I think a while I was thinking to be a surgeon, right? But I used to scrub in, and the mask just drove me crazy, and I just knew I can't wear a mask for hours and hours. It just really bothered me, right? So if you're not enjoying it, it means you're not doing a good job at it, right? Like, what eventually makes you a good doctor is you have the strengths for that field. I think internal medicine, big part of it is connecting with patients, being able to understand your patients. I think what really kind of helped me is start to think of the patient like their home life. How are they at home? What's their home life look like, right? And that helps you not only diagnose certain things, but when you discharge them, right? You thought of the different nuances that can make things difficult for them when they go back. Like you said, if you feel like I hate talking to people, then find a jump into another medical field where there isn't that much patient interaction. Pathology, right? Pathology, you just sit there and do things, right?
Yeah.
Look at slides, right? Or you can do like interventional radiology, right? Where if you like procedures, right? So if you like procedures, do interventional. So yeah, that's what I would say. I think step back, explore, see what else is out there.
Moving on
Um,
to the next question. How do you think artificial intelligence, which is the buzzword of
yeah.
this day, how is this going to affect internal medicine, the field of internal medicine in general, and the medical students in particular?
I feel like in many ways it's making my job easier. For example, if there's an AI which can write, even 50% of my notes, and that makes me enjoy my job better, and I could do more, and I could kind of focus more on patient care rather than just kind of documentation. So I think, it's kind of real early to tell, but I'm seeing it changing a lot of
Something
fields.
mundane that you
Um,
think it's not very enjoyable in my field. I do not enjoy it while being as a hospitalist. It's just too repetitive, too redundant. Is there a particular task?
Yeah, note writing, anything associated with insurance, that type of mundane, that stuff is there, and you have to just try to just deal with the best you can. It's that type of mundane. A couple months ago, I had a patient who had this like swollen right foot, and we were thinking, oh, maybe it's the lymphatics or it's DVT, all these type of things. And we never really figured it out. And then I continued following her, and then 3 months later, it turned out she just had a rare form of gout, which just affected the whole foot. You know what I'm saying? And so and so like I just kept following and following because I was so puzzled by it. So just the puzzle of the human body and everything that comes with it, and then you take that with you, right? You're like, wow, gout can be, it doesn't always that big toe or the elbow, but it
Yeah,
can
yeah.
be the entire, and it causes
The
like
bookish knowledge is
yeah,
quite
it was
different
like
from
like edema
what you
of the
see in
whole foot,
hospital.
which was really strange to find that out. So finally still having those interesting cases, those cases that throw you off and kind of eat at you. I just really enjoy those, and I continue to follow those as well. So I think that's another part of it that I enjoy.
Because when we talk about gout, the only thing that I've seen is the big toe getting
Yeah,
all the swelling,
exactly.
and they're writing all sort of terms. But you have just mentioned it, so yeah, it is interesting because I have also seen some very peculiar cases while I was a student. Especially last year, I saw a case of someone who was a pigeon breeder, and I've only read about pigeon breeding in books and how pneumocystitis carini, the fungus in the pigeon droppings. I've only read about it, but in that patient, I saw it infecting
Wow.
his lungs, and our resident, pulled out a straw-colored fluid from his, pleural fluid, and I saw it first time in front of my very eyes.
Wow.
She was sending it for the diagnosis, but it is interesting that how we can connect the theoretical knowledge with the practical knowledge. So I think
Yeah.
internal medicine gets a point for that one because whatever you're reading in books, you get to see it in real life as well.
It is
Okay,
amazing when
so
you read something in books and finally see it. It's just an amazing feeling to be like, wow,
yeah,
it's
I,
actually does happen. So I agree.
I also recently saw a patient of Heliobacter pylori, and the doctor who was my senior, he immediately prescribed that 14-day regimen of omeprazole, amoxicillin, clarithromycin, and I was like, yeah, I've read about it. I read
Yeah.
this thing in pathology, and it was quite interesting. So just for this, bit of reflection time. If now you decide to go back into the past, is there anything you would like to change in your learning strategy as a medical student? Is there something you would like to work upon, like, you might think of it as a mistake that you might have committed, like, um,
Oh,
and it
okay.
had created some difficulties for you as a hospitalist, or you're like, no, I'm content with where am I right now, and I just want to continue like this.
So I'm content with where I am right now. I feel like I'm in the right place that I want to be. I'm enjoying it. I think this suits my talents. One thing I worry about is because there's a lot of walking around, running around. How long can I do
Mhm.
it? Right now I'm young, so I can, it's no big deal. But I am kind of worried, like when I'm 60, 65, running around a hospital, sometimes doing stairs, and there is stressful times, right, as well, when someone is really sick and you don't know what's going on, or you're trying to get something done for a sick patient, but you have these barriers that you have to overcome. So, those things do get to you, and so I sometimes do wonder if I can do this when I'm 60, 65. Those things do get to you, and the way I studied, I felt like I was pretty efficient at studying. I used Anki, those flashcard systems. It actually took me 8 years to get through med school, because I had to drop out multiple times for financial reasons, and I was actually working while I was in med school too. I started a tutoring center just to pay for my med school fees because I had 4 kids. So it forced me to become real efficient and really kind of like I couldn't waste time, right? So I think would it have been nice to like not have anything to do and just focus on studies? It would have. I think it would have been nicer, but I think overall, it just made me more made me kind of approach things much more like to the point without going around and like uh, chasing my tail, right? And for just like these little things that may not be so important. Which I you know and I feel like a lot of my colleagues did that where they would like I think if you want to do, especially if you want to do clinical, right? Kind of focus on what is clinically relevant a lot of times. And then the basic sciences are important if you have a good understanding, but I think delving too deep and like trying to become an expert in chemistry or physics or something, it's not like doesn't really help. You should have a good solid understanding of it. But I just noticed a lot of people delve too much into things that wouldn't necessarily translate clinically to much. So that would be my thing. But personally, I think because of my pressures that I had, I was very efficient and kind of getting to the point. And I think I learned a lot of really cool study strategies along the way, which really helped.
Okay, so just to sum it up, how will you conclude this whole conversation? Like, what would you advise medical students if they want to become a hospitalist or an internal medicine specialist? Is there any specific strategy they should be taking? And how should they continue if they become one, especially in the USA? Because a lot of my class fellows are about to get matched in 2025, and many of them are preparing to take their step two or step one, and they were just curious to know that how what is the path to become a hospitalist in the United States. And the last comment, if you can give on this whole, the field of internal medicine in general, how does it look like, what you have to deal with, what can be the consequences if you are a family man.
Yeah. So just to sum it up, I think the biggest thing, just in general, I guess, kind of starting broad. Look at yourself, look at what you're good at, look at what you enjoy, and I personally feel that medicine is so broad that you could find something you would like you would do well with. You just have to kind of be creative with it, and then keep in mind there's also research, there's also the business side of medicine, right? Look at pharmaceutical companies, this and that. So there's just so much. I think once you have this knowledge, it's can be applied in so many different ways. You just have to kind of go out and look for it and be creative in the way you
Can you
work. So that'd be my
tell where to look for these resources? Because I am looking here and there, like I'm contacting people in pharma, I'm contacting people who are in healthcare but are not doctors,
Mhm.
but still they're earning pretty much well because they know how vast the healthcare industry is. So if you're like talking about, looking here and there, can you like mention some resources?
Yeah, yeah. I just kind of threw out pharmaceuticals, but like again, I think it's so big. It's it's not like you're going to find it in one place. If you think that something might be vaguely interesting, especially if you're young, right? I'm 41 now, so for
Mhm.
me, like, to start like just kind of jumping around everywhere might not be a good idea. But if you're still 20, 25, just kind of get out of med school, you're not sure what you want to do. I think, like, if you find something even vaguely interesting, just start somewhere. Google something, find a company that does it. Reach out to them, and then kind of get started, right? I do consulting work for like a medical device company. I just I started with they wanted help with advertising. I was a good writer, and so they wanted someone to just develop medical writing material. And so I got to know the company, and then the company grew, and I grew with the company, and now I'm doing like research with them and things like that. So I think keep in mind you'll grow as a person, you'll develop more skills, and so that's also going to happen. So give your time to grow and move forward. And that I think that the idea that there's like a way to do it, like one way to get to it, I think you have to get away from that. I think it's more about just hustling and just kind of putting yourself out there, letting it be known what you're into. I think that's just kind of like a general approach, but nothing specific. Like, I can't give you a website or
Yeah, right.
a 1, 2, 3 step plan. So just find something. If you're vaguely interested, start there, and then life. And then as you go through things, I feel like you'll naturally gravitate towards what you're good at, and and people will recognize you for it. If you want to get into medicine, so you said the one question you asked was how to become a hospitalist in the U.S. Is that what you're saying? U.S. So once you do an internal medicine residency, you can work in hospitalist right away. You don't need to do like a fellowship. There are fellowships available, but it's more if you want to do like the business side, or you want to do more research within the hospitalist field. But you can just start. And I didn't do a residency, a fellowship after my residency. I think the general, and so I'm an IMG as well. I actually studied in Dubai in medical school, and then did my residency. I know the pressure of like being an IMG, and how that can become difficult. Um, but I would just say, like, I think sometimes, like, for a lot of people who, because a lot of people go through it, and a lot of people like fall off. And I think the important thing is, I think the ones who were more thinking like I'm competing with everybody else, I think they felt like a little bit of pressure, and then they died out. And these were the people who were like, they're looking up, oh, so and so got this grade, so and so got this grade, right? And they're like looking at what other people were doing, and then comparing themselves with that, and then they got like psychologically just kind of messed with them, and they couldn't do it, right? Or they got so scared to take the steps because they felt like, I need to do really, really well. I mean, you should do well, but they just kind of felt like I need to do like this guy did. I feel like it's more about internally pushing yourself, right? I
Mhm.
think it's more be like just keeping
Internal
certain,
validation.
huh?
Gaining internal validation. Like,
I just really tried to, like, it was more about me being the best version of myself and really putting my best foot forward. I think that's what kind of helped me get through it, because it is stressful. These tests are like so high stakes, right? I mean, it's like
yeah,
everything rides on these tests. If you don't do well on these tests, it's over, right? So I just kind of kept focusing on myself, and like, again, it kind of goes back to understanding yourself. Like, I just figured out, like, what is the best way I study, what are the best techniques that I want to utilize, and then employ those, and then constantly just get better and better and better. So I feel like life is a lot about just getting to know yourself, what you're good at, what you're capable of. And I think, as long as you keep pushing hard, you always surprise yourself of what you're actually capable of. I think just kind of focusing on yourself, don't get too bogged down in other things, and just kind of hammer away, and inshallah you get there.
and keep helping others on the way, right?
Yeah, of course. I always felt like when you teach others, that's the best way to learn, right? And the best way
Yeah,
to kind of really learn something is after you've explained it to somebody. It really solidifies
yeah,
it.
yeah.
So
I've heard that it a lot. If you want to become good at something, just teach it to the next person, and then you will never forget it.
yeah, and even psychologically, I mean, I think teaching, studying can be so lonely, sometimes.
Hmm.
So, teaching others and then creating that environment of collegiality and scholarship, right? And teaching each other and supporting each other. I think that's really important. Having a good group of friends who all kind of support each other, help each other get through it. That's like I would say almost essential. If you're on your own and nobody's talking to you, you're not talking to anybody. I think that's just not healthy. Reach out to people,
Yeah.
in classmates and stuff like that. That's all.